So what's going to be different 2 days from now? Well, in Multnomah County, restaurants and bars will be allowed to provide seated service. Personal service providers can see clients by appointment, and gyms and fitness centers can reopen. Our county made great sacrifices to get to this day, and I want to thank everyone who stayed home so that Multnomah County could build a comprehensive, equitable response to this ongoing threat of COVID-19. Multnomah County has proceeded strategically and cautiously to arrive at this point, and we are ready to move forward in a way that ensures that our gradual reopening and subsequent recovery from the broad impacts of COVID-19 do not leave behind already vulnerable communities or perpetuate the disproportionate economic and health disparities that place them at that risk in the first place. Our plan recognizes and prioritizes those for whom a system of racism and oppression have disproportionately put in harm's way, Black and other people of color. We have centered our efforts to address this harm in our partnership with communities. I personally want to thank Public Health Director Rachel Bynes and her amazing team for their relentless pursuit of health for all. But I have to point out that this cannot be and will not be a return to business as usual. We need to keep doing what we know will slow and stop the spread of this virus. Slow and steady wins the race. At a minimum, proper physical distancing will be required for all of these settings to ensure that people can gather as safely as possible. Thank you.
Rachel, would you like to go ahead?
Sure, I can. I initially thought Jen was going to go, so.
Oh, sorry. We can have Jen go.
Sure. Thank you, Chair Kafori, and good afternoon to everybody. For the record, I'm Dr. Jennifer Bynes. I'm speaking to you as the Multnomah County Health Officer. I know many are going to greet this as good news. I want to emphasize that safety is relative. This virus is in our community. We expect cases to go up. We know that it can find its way easily into people who are more vulnerable and even people who on paper should not get seriously ill from this virus, but we know it happens. So our goal is going to be to minimize hospitalizations, minimize deaths, but there is a trade-off here that we're making consciously in reopening restaurants, bars, personal services, and gyms. And it's going to be on everyone to continue the physical distancing measures we've advised, now face coverings, as a way of preventing the spread of this disease and protecting each other. So this is the new stay home, is to maintain the 6 feet and use face coverings. I want to emphasize that what we're seeing in terms of disease transmission is that it's really people's close, prolonged social contacts, whether that's at work or in groups. It's also, of course, happening in long-term care facilities, and anywhere people have close, prolonged contact, and anywhere where people are struggling to maintain the 6 foot distance and regular use of the face covering. So while you don't have to be perfect, we have to urge everyone to continue these measures and understand that as we look at case counts and we look at disease transmission in the coming weeks, again, the numbers will go up. We hope that hospital capacity can accommodate those who do get seriously ill, and we certainly hope to minimize the number of deaths, but understanding that this virus can kill people, and without a vaccine, without treatment, this is what reopening looks like, and it's individual and group conscious responsibility around maintaining the precautions that we've recommended. I think with that, I believe it's now Director Banks's turn.
Thank you. And for the record, my name is Rachel Banks. I'm the Public Health Director for Multnomah County, and really want to underscore a couple of things. And one is that this is really up to all of us in reopening to slow the spread of COVID-19. We've built a robust response and have moved forward very cautiously and thoughtfully to make sure that we have contact tracing in place and testing in place and other interventions to protect folks and the most vulnerable people. We've also heard today through the governor's announcements that face coverings will be required in indoor settings, and want to make sure that people have access to those face coverings that's another step that people can take. But really, once again, want to underscore that public health cannot do this alone. We need you all. We need community members. We're asking that in our contact tracing that folks work with us, pick up the phone when we call back if we leave a message, and really have conversations so we can understand your contacts, your health needs, that we can slow the spread of the virus. I want to be clear that contact tracing in and of itself is not going to stop the spread of COVID-19. Ultimately, it's in our community, as is said, until we have a vaccine, but that allows for us to make sure that contacts have access to testing and follow up as quickly as possible so that we can minimize and slow the spread of COVID-19. In regard to the face coverings requirements from the governor's office, we ask that folks are kind and considerate to others. There are a number of reasons why people are unable to wear face coverings, whether that be for disability reasons or for health reasons. And we also know that some members of our community experience disproportionate racist impacts and have been uncomfortable wearing face coverings to this point. So we are asking that folks not make judgments if they see people in public spaces and consider that perhaps there are some reasons why they are unable to wear face coverings. Thank you.
Thank you all so much. And I think we'll open it up for questions. Just a couple pieces of housekeeping. Reporters who are joining us through the Zoom app, you should have the power to unmute yourselves. And if anybody is dialing in, the *6 should allow you to unmute and mute yourselves. Please do remember to tell us your name and the media outlet you work with. And also please remember to mute yourself if you're not asking a question. With that, it's open.
Erin. Ozier from K2. Talking about the masks and that now being mandated by the governor, is there any way that we will in Multnomah County be enforcing this, that people need to be wearing masks in public situations like grocery stores?
Thanks. I'll take that question. This is Jennifer Bynes, the health officer. I think we'll have to see how the governor's policy comes down exactly. I would just echo what Rachel Banks has already said, which is that we've taken a stance that face coverings is a strong public health recommendation. It is ultimately a voluntary action, and not everyone is able to wear a face covering or feel safe wearing a face covering from a racial discrimination standpoint. So we'll be waiting for details from the state, but our general philosophy is to make it as easy as possible for people to use this protective measure and to get the full benefit of it by making it available widely and by essentially normalizing its use. So I would say more to come as details emerge from the state.
Erin Metzger with Willamette Week. My question is regarding the mask policy in restaurants. Does this policy apply to restaurants and bars? And if so, have you received advice from the governor's office of how that could be implemented?
Again, Jennifer Bynes responding. I go ahead, Chair, because I was going to say I don't know. Please go ahead.
Yes. Hi, Erin. We had a conversation with the governor and asked one of the reasons why she is not having this take effect until June 24th is so that they can prepare the guidelines, which I'm sure will include how people are supposed to eat and drink while they're wearing face masks, among other things.
Chair Kafori, it's Zane Sparling with the Portland Tribune. Any concerns this is taking away local autonomy?
No, Zane, I think we've been very clear from the beginning that we believe that wearing face masks and face coverings is an important step towards slowing the spread of this virus and protecting not only the person who's on the receiving end, but also we're learning that it offers protection for the user as well. I will say that just from my own perspective, I think having a similar recommendation throughout the tri-county area is much stronger than one individual county, because as we keep saying, people work in one county, live in another, and recreate in a third. So it makes sense that people have a similar recommendation around the tri-county area.
Chair Kafori, Pat Doris from KGW. I know you talked to the governor. What changed between last week and now to make this happen?
Well, that's a good question, Pat, and that's not one that that I thought to ask her. I think she was trying to take a statewide look And so it's not just, she didn't just issue recommendations for the Tri-County area. The recommendations moving forward also included direction for Polk and Marion County and Hood River and Lincoln County in regards to the face covering. So I think she was trying to have a consistent statewide message.
This is Ben Botkin with the Lund Report. I was wondering, as far as Multnomah County becoming one unit with the other two counties, is that anything that you guys advocated the governor's office to do? Can you give me a sense of what the behind the scenes talks were on your end for that?
I will say that from my perspective, I did not have a conversation with the governor about that. I do know that our health team is in regular and frequent contact with members of the governor's health team. So I don't think this should come as a surprise to anyone, and I don't think it came as a surprise to the other counties. We've been working very, very closely together since the very first case occurred in the Tri-County area, realizing that the virus doesn't understand geographical boundaries.
John Hendricks with Channel 12. Is there any message to the business community? You know, they've been under these restrictions like a lot of us have, and we've seen some restaurants go out of business and others struggling. Any message from Multnomah County leadership for them as they kind of move forward in all of this?
I would say that I've spoken with a lot of business owners and business leaders and business associations over the past 3 months. I know that this has been really frustrating. People are hurting, individuals are hurting, businesses are hurting. And I just want to make sure that people understand that this is not a call to open up and go crazy. This is not a time for people to get back to quote unquote business as usual. We still have to maintain 6 feet, if possible, of physical distancing, wear a face covering, and remember that the virus is still out there.
I'm not sure who this question goes to. This is Kelly Ozier from K2 again. But obviously, over the last couple of weeks, we've seen the numbers, even without being in phase 1, we've seen the case numbers continue to rise. Is there a concern that now with opening up, we'll just continue to rise even more? And how do we mitigate that with more businesses and more places being open?
Dr. Bynes?
Yeah, hi, thanks for the question, Kelly. This is Jennifer Bynes, health officer. I think if I will assume that businesses are going to put in place the recommendations for physical distancing and face coverings. I think if they do that and if people respect that, there should be relatively low risk of spread in those scenarios. I think, again, where we're clearly seeing spread is people with their close social contacts, gatherings, parties where people maybe let down their guard a bit with loved ones and social contacts who are not in their household. So we will see. I expect case counts to go up. It's hard to say with having had our neighboring counties open now for a couple of weeks, having had protests recently, and now reopening. It may be difficult to tease out the exact role of any one of those things. So again, this is on individuals, it's on businesses, it's on us as a community to try to keep this virus at bay.
Zane Sparling with the Tribune. What does contact tracing look like in the context of a large-scale protest where you don't really know everyone around you and some people may not want to be known?
Rachel, did you want to?
Yeah, absolutely. Takes a second to get to that mute button. So, we walk through people with their contact tracing, where they've been, who they've been around each day, hour by hour sometimes. But, people will share with us the information that they want to share with us. And so we also understand that we may not know from our contact tracing interviews if someone was at a protest, if they didn't want that to be known. That said, we will be asking, and if there were more than 5 cases that we could attribute to being at the protest, we would want to make other folks aware of that. But once again, really the messaging going back to please wear face coverings at protests, try to maintain that distance, and maintain six feet from each other. And then we want people that are protesting when they're coming back to be washing face coverings, try to stay away from other folks in their household contacts, washing off faucets and shared surfaces and all of those sort of things. But so to come back to the question of contact tracing, we will do our best to understand if people were at protests, and that's also voluntary information. I'll say one other thing, that for folks who've been at protests who are symptomatic, we have a testing site at East County that's open twice a week, and there are other testing sites across the county and health systems and whatnot. And so we want folks who've been at protests who are symptomatic to get tested at their first sign of symptoms.
Ted Sickinger. Hi, this is Kate Wilson. Ted Sickinger with the Oregonian had a question. Ted, can you? Ted, we can't hear you. Ted's question, let me pull it up here, was I'm trying to ask if we can get an update on the public health indicators, hospitalization numbers, positive test rates, racial ethnic breakdown of infections.
So this is Jennifer Bynes. We are preparing an update for our Board of County Commissioners for tomorrow. I will just say that the state indicated that it was our hospitalization trend, even though the numbers were very low to call a trend, that was of concern last week. And that number, as the state is interpreting it, has essentially remained flat. So we do meet phase 1 reopening criteria. More to come.
Someone else speak at once? Anyone?
I cannot speak for the other 2 counties, but I was not asked whether I thought it was a good idea. However, if I had been asked, I would have said yes, because as I've been saying since the very first case came to the Tri-County area, that the numbers reflect where you live, not where you work, or maybe where you spent your weekend. So it's somewhat, I mean, while it's important information to have, it doesn't tell the full story of where the virus is, where it's being spread, and where people are getting it. That's why we have the contact tracers. So I think, especially in this county where everyone is so intertwined, it's really important to have a consistent set of recommendations.
Erin Metzger again. I want to follow up on the question regarding enforcement and potential penalties. Have any of you spoken with the governor's office regarding what that policy will be, whether there'll be an enforcement mechanism? And if so, what advice did you offer the governor's office on that point?
I did ask that question of the governor today, and she said that they obviously don't have the ability to enforce throughout the 7 counties that will have this new face covering mandate. But she didn't go any further than that and said this is one of the issues that they're going to be discussing, and that's one of the reasons why they are holding off the mandate taking effect until June 24th.
Thank you.
I have another question here from Ted. Last week, you told us that fewer than 5 positive cases had told case investigators that they had attended demonstration. Is it that case investigators are no longer tracking the number of infected contacts? Is the state's database Orpheus capable of that? If so, If so, why or why not? Why is the county deferring to OHA on that, when the bulk of demonstrations and the largest crowds are in Portland?
Yeah, so this is Jennifer Bynes. I can take that question. So I did share last week, anecdotally more than anything, that our public health staff had understood from less than 5 people, so a handful of people who were positive for the virus, that they had attended protests. Our investigators are going to start asking broadly about attendance at gatherings, including large and small. And they will be working with the state to create a place to put that information in Orpheus, which you referred to. That is the state database for public health investigations. That's where information goes in, and that's where it gets pulled from. So anything that we want to be able to look back and measure and really understand really has to have a dedicated spot in that state-owned database. So that question will emerge, that data collection we expect to have set up. But I will just put a finer point on the contact tracing. I think people are very interested, understandably as I am, in the impact of the protests on disease spread. The contact tracing function is really to find people who were exposed, not necessarily where they were infected. And often it takes a while for our investigators to link certain cases or for a cluster of cases to emerge that have that thing in common, whether it's a work site or a gathering. So again, I know there's a lot of interest in this. We'll be watching the numbers, we'll be sharing what we know, but there may be a lot that we don't know about the protests. So, so just to put a finer point on it.
So is there any update on the total number that were sick and attended protests?
Again, I have no update. What I shared last week was anecdotal. We're trying to build more systematically this question into our public health data gathering. And so I don't have updated numbers.
Ted at the Oregonian, still having a little trouble with his mute. Asking, how quickly are you able to respond to community group requests for testing, particularly among vulnerable populations? For example, are you getting general requests for mass testing, and are you responding to them given the county's testing numbers are still low relative to capacity and that the state has one of the lowest per capita testing rates in the nation?
This is Rachel Banks. I can take that. So we are working with community organizations and communities who want testing. It is quite involved. I think there's more to it than people expect in terms of logistics, finding a location, ensuring that we have all of the pieces put together, all of the staff in place that need to be there. So we are moving forward thoughtfully in that testing and having a team of folks that are working with community-based organizations to make sure that the testing runs smooth, that we really have the right location, the right communication strategy and ability to give people back their test results. We have stood up a number of community testing sites and working in partnership with nonprofit organizations, as well as we've stood up our regular community testing site out in East County. So we continue to be partnering with community-based organizations on that, but also ask for folks to have some grace with us as we really want to get the details right, particularly in having people who might be sick and already experiencing some hardship in their lives. We want to make sure that we have appointments and ways for them to come through that testing process in the smoothest way possible.
I also want to remind folks that the county is not the only organization that's doing testing, and nor do we have the capacity, or nor should we be. There are private hospital associations, hospital groups, hospitals around this county that are doing testing as well. So it's not just Multnomah County.
We can take any last questions before we let you all meet your deadlines today?
Yeah, this is Ben from the Lund Report. I was just wondering, with going to a 3-county unit, do you have any thoughts about how this will affect your planning as you move into your phase 2 application and how you'll approach that?
I will just say that for us at Multnomah County, we hadn't yet contemplated moving into phase 2, as we're just now learning we're moving into phase 1. I think the effect will be mostly on Clackamas and Washington counties, especially Clackamas, which has been in phase 1 for a longer period of time. I know it's not only at the chair level that we're having constant conversations. Rachel Banks and the health department directors from the other counties meet regularly, as Jennifer Bynes and her tri-county health officers do as well.